2, 1.
Welcome back to 1221 Live, the show where we have honest, judgment-free conversations around sexual reproductive health. Today, we're having a very saucy, very interesting conversation. It's the topic that most people are shy to talk about, but so many people need advice and help on. Joining me today are two very prominent, very important men in the sexual reproductive health space and in the health space in general. I have with me today Dr. Noel and Dr. Isaac. Welcome, doctors.
Thank you.
All right. So could you please introduce yourselves to us?
Okay.
Dr. Isaac.
So, for all the stats, I'm Isaac Bomadankwa.
Yes,
I'm a nursing officer at Yebo Hospital, also same as Bojo Polyclinic. That's basically
interesting. Yeah. Two jobs. I'll see you in chambers. Dr. Noel.
Okay, so I think some of you already know me from previous episodes. I'm Noel Senyo Kumade. Yes, I'm a medical doctor at Ridge Hospital. Yes, I'm also a content creator, a footwear blog, as well as a model. So I think that's it.
Welcome back, Dr. Noel.
Thank you very
awesome
much.
to have you here. Welcome, Dr. Isaac. It's great to have you here as well. Now, today we're talking about erectile dysfunction. Yes, you heard me right. Erectile dysfunction. Dr. Isaac, what would you say erectile dysfunction is?
So erectile dysfunction is basically the inability to keep an erection that is great enough for sex.
That is great enough for sex?
Great enough for sex, yes.
Wow. That's quite the caveat. Could you please elaborate?
So, many men, have this inability to keep an erection for sex right from the start to the end.
Wow.
Okay. So I think you have opened up your eyes a little bit. So
I'm interested.
So this is what usually happens with men that have erectile dysfunction. When the inception of ideas for sex starts coming, let's say when you have a lady touching you, the usual thing that should happen is you should get an arousal or an erection, basically.
Yes. Yeah.
But then what happens with them is, with whatever thing the lady does, there's no erection.
Oh, okay. You know what? Usually when that happens, as girls, we feel like it's us. So, we feel like we are the ones that are not attractive enough. But it's actually a condition.
Yeah, it's a condition.
Okay.
And in as much as it's not too rare to have it in men, still people do have it.
Okay.
Yeah. But then regardless of the acute or the immediate causes that may happen to be a cause of the erectile dysfunction, if it happens frequently, it becomes a condition and it needs to be treated.
Right. Okay. Thank you. Now, Dr. Noel, as you said, it could happen occasionally, right? And if it happens frequently, it becomes a condition. When would you say that it is reaching the condition stage and then the person will need to seek help? Or what would be the difference between, normal performance issues and then erectile dysfunction as a condition?
Okay, so as I said, erectile dysfunction is basically the inability of a man to, first of all, to attain erection and also to maintain erection. That means you can't go hard and you can't keep the erection either. Yes. So for you to actually diagnose erectile dysfunction, you need to talk to your medical provider. Yes, he is going to ask you some questions which would probe further to your diagnosis. Yes. So if he asks you that, are you able to, first of all, to get an erection, and you say no, anytime it happens, you're not, even in as much as a girl touches you or the thought of sex, or even some people perceive smell and they are aroused and they get an erection. Yeah, true. So either tactile or even just the thoughts or even the smell can cause you to have an erection. If all these stimuli and does not cause you to have an erection, then we can diagnose you of ED. Or better still, you might have an erection, but then 1-2 strokes per. It's not that you've ejaculated. It's different. That one is the premature ejaculation. That one I think we'll talk about later. Yes, but you're having sex, but then after a few minutes, you're just down. It just goes down. Yeah, it's basically due to the venous drainage. Yes, it has several causes, both organic and psychogenic causes. Whereas the performance issue is basically due to anxiety. Probably you've met some hot girl or you see her, and you want to show impression. You want to at least show her that you are on top of your game. But that overthinking, that one is mostly due to the mind. It's mostly due to psychological effect.
Okay.
Yes.
Okay.
So most likely anxiety. That's the most cause of low performance. That one is different from erectile dysfunction.
Mm-hmm.
Yes, that's
Okay.
that's
All right. Yes. So, I mean, if you're listening and it's not, you know that it's not anxiety, then please stay tuned and pay attention for the rest of the conversation. Now, Dr. Isaac,
Yes.
what exactly causes erectile dysfunction?
So erectile dysfunction has a series or a wide range of causes, and then they may be classified or divided into physical causes and then medical causes as well.
Mm-hmm.
So for the medical causes, that may be related to having some underlying medical conditions, having problem with the communication with your nervous system, because it's from your nervous system that would release the testosterone hormone for the erection, basically.
Oh.
So if there's a problem with that, there
Oh.
won't be any erection too. And another cause of it is also side effects of medications. If there are some medications you are taking, for example, medications for hypertension, antihypertensives basically, also have that effect of giving the consumer erectile dysfunction in the long run.
Oh, okay. Dr. Noel, please, before I come to you, I
Mhm.
just want to ask, are there any remedies, for someone who is experiencing erectile dysfunction from taking a medication?
If the repair doesn't come from taking the person off the medications, there are also medications that also won't cure the erectile dysfunction wholly, but will aid the person to keep the erection throughout the course of having sex to the end.
That's like Viagra, right?
Yeah, like Viagra.
That's the one I
like
know.
Viagra.
that's the most common.
Yeah, that's the most common, of
Okay.
course.
All right. Okay,
Yeah.
cool. Thanks, Dr. Isaac.
Yeah.
Now, Dr. Noel, Dr. Isaac has spoken about the medical causes, right? But I know that some people, it might be in their heads. Could you please enlighten us on some of the psychological causes of erectile dysfunction?
Yeah, so for ED, that's erectile dysfunction. We have psychological causes or psychogenic causes. Yes, and it involves a whole range of psychological issues, ranging from depression, anxiety, to even lack of sleep, stress. Yes, stress can cause you to have ED. Yes, for depression, it's basically lack of happiness over a period of time. Yes, so consecutive lack of happiness. Get it? Yes, so sadness, extreme sadness. I mean, if you are sad, how will you get an erection? Like, you need to be aroused. You get it? See, the whole thing is about the brain. The stimulus comes from whether tactile or auditory stimulus or anything, or even just the thoughts. So from the brain, that's when it sends signals through the sympathetic nervous system down a whole cascade of events before you get an erection. Yeah. So if your brain or your mind, let's say your mind, is not well tuned to to having sex, definitely you're not gonna have an erection. Get it? Yes. Also, the anxiety can also cause, as well as poor sleep. People are stressing too much. Me like this, Charlie, I'm stressing. It's pulling my neck. Get
You're a
it?
busy man.
I'm quite busy. Yeah, so all these can also amount to erectile dysfunction.
All right. Thank you. I really didn't know that so much happened for men to get erections. I thought it was like a switch, turn it on, turn it off. But to both of you, Dr. Isaac and Dr. Noel, how do lifestyle choices also affect, let me say, in this case, sexual performance, or how do lifestyle choices induce, right? How do they induce erectile dysfunction in men?
So with lifestyle choices, I'll talk about food, basically. Or let me leave the aspect of food aside. When someone is obese, someone is overweight, when someone basically takes in, someone would say junk food, doesn't eat healthy.
Yeah.
Okay. The result of whatever thing that is happening in your body is from what you eat. Just like if you're taking garbage, you're going to bring out garbage.
Yeah.
If you're taking some things that are healthy, you're going to bring out healthy stuff.
Yeah.
Okay. So if you're taking junk foods, it's basically junk you're eating. So everything, your performance, everything straight from you breathing, you walking, everything is going to be junk.
True.
So that is the communication between it. And then also with smoking, alcoholism, drug abuse, as basic as that, those also influence your performance sexually.
Wow.
So people may think, if I go and take in alcohol that has this mixed with it, that has this in it, that has this and that. Of course, you're going to have that sensation as at that point. You're going to get high, you're going to get aroused at that point. But what if the effect or whatever thing that you're taking, it goes off? You'll still be left there.
Yes.
And then the work that you give to your organs when you took in those things, I feel like organs not bread.
Yeah.
So now I start to go. I'm using chi. I feel now you are 30 years, but your organs is like 60 years old. Yeah, so that's how it is like. Okay.
So, Dr. Noel, please, do you have anything else to add?
Okay, I think he has actually said it all. For ED, we have predisposing factors that cause this medical condition. You mentioned that some medical conditions can cause ED, such as hypertension, as well as heart diseases, as well as how do they call it? High cholesterol, that's hyperlipidemia and all. Yes, so these lifestyle modifications or these lifestyle choices would influence or precipitate the disease. You get it? Mm-hmm. So if you are smoking and you are drinking a lot, yes, you'll be predisposed to having these heart diseases and hence erectile dysfunction. Because if you're having heart disease, the erection is mainly blood rushing into the penis to make it erect. If you're having this heart disease and your heart's not able to pump enough blood, or probably a stroke where you have paralysis of some part of your body, you can't have an erection. Get it? And these strokes and these heart diseases and others are as a result of these lifestyle choices: smoking, drinking, junk foods, and a whole lot. Yes. So I think that he has basically said everything about it.
All right. Thank you so much. So there you have it. Please take care of yourself, men, so that you can enjoy your sex life to the fullest.
To the fullest.
Now, moving on to myths and facts around ED. For me, the most common one I've heard is the fact that it's an old man problem. It's usually old men that experience this. Are there any other myths that you guys have heard? Let me start with Dr. Noel.
Okay, so I learned ED cannot be treated, but it can. Yes. Also, I've heard that erectile dysfunction is mainly because of the penis, as in a dysfunction of the penis, as in a problem in the penis, which is not true because we've debunked all that, saying that there are a lot of medical causes. You get it?
Yeah.
And a lot of, I think, some other funny ones. I've forgotten them. I'll try to remember.
I'll come back to you. Dr. Isaac.
Okay, for the first one, you said that ED is for young, old men only.
Yeah.
ED is not for young, old men only. Everyone can have it, whether you're young, whether you're old. We have people, or what also, if it's for old men, what have those people that are 80 and still giving birth, impregnating people?
True.
Right. Yeah.
Yes.
So it's not for old men only. And then the second thing they say is it's only Viagra that cures it. Because I think that is what
most common
thing that. But then they have that even up to surgery.
Surgery?
Yes.
Wow.
Even up to like surgical interventions for ED.
Is it major or minor surgery?
They are major.
It's okay.
Mostly implants.
Yeah, implants basically.
I have so many questions, but I'll let it pass.
The implants basically. So there are cures, other cures, not even Viagra, for ED. And then the next thing, people also resort to herbal medicines for ED, basically. Yes.
Like the roots.
Yeah, the roots where you go and pick mahogany roots, coconut roots, whatever roots, and mix it, create a certain concoction, and be sitting in the room and then drinking it. Now, you are taking that for ED. Of course, the mahogany is going to help, the coconut is going to help, the cramine, whatever, is going to help. But in as much as it's helping, you are not taking it in the right amount. So it's either it's underworking or overworking. If it's underworking, you are clearly not getting even what you are doing in the first place. And then if it's overworking, oh yes, it's overworking. You've taken it. You've watching girl, you've massacred the girl. Come on. But after that, you end up getting other health conditions. Wow. Other conditions where your organs that you've given them the work to filter or everything you're taking in out of your system.
Wow.
So that is what another thing people do. You won't go and see the doctor about it. You won't talk to no one about it, not even his partner. Then you go and see, hey doctor, whatever, and then you go and do some things and then taking it. And that is also another outcome out that they made actually.
Please, if you're experiencing symptoms, please go and see your doctor. Don't make things worse for yourself. Dr. Noel, please, have you remembered any other myths?
Nah.
Okay, I have one for you.
Okay.
So I've also heard that people say that it is a punishment.
Punishment from the God sword.
For promiscuity and masturbation.
Oh no. That's definitely not. That's definitely not. Yeah, because we've all learned today that it's a medical. I mean, it can be a medical course. Get it? For spiritual, unless you go and ask your God. Yeah, but we are in the medical field, so we deal with facts. Get it? Yes, yeah. And we've done our research, and we know that ED is not from any gauze, river gauze, or anything punishing you. But it's basically because of our lifestyle choices, because of our predisposing diseases. Yeah, that's causing that. And for the masturbation, that's not true either. That's not true either.
Okay, that's it. I'll tell the person who told me that's not true. Okay, so Dr. Isaac mentioned treatment options and cures, right? What's the most available, ready, let me say, over the counter cure
Okay,
for
so
ED?
I think in the late 1980s, there was a drug that was undergone a trial, yes, for pulmonary hypertension. Yeah, drug by name sildenafil, yes, popularly known as the Viagra. Yes, when they did this trial, they realized that the candidates for the trial had erections, began to have sustained erections. Yes, sustained erection for quite a long time. Well, those who had those side effects were actually happy. Yeah, they were actually happy.
I mean,
So they didn't even return the drug to the company that I linked. Yes, so they later found out the side effects and thereby making it a widely known drug for treating ED. Yes, hence the name, the Viagra that we mostly take. Yes, so with the mechanism of action, yeah, it's quite complex. It inhibits some enzymes, which aid in the sustaining of the erection. Yes, so
that's quite interesting.
Yeah, I mean that's the most commonly used medication, but we have some other.
There are others.
Yeah, there are some others, and also not just medications as well. Some other forms of treatments. I don't know if you want to say it, but
So other forms of treatment for some people that I don't think is available here, but in other countries they go for hormone therapies.
Hormone therapy.
Yes.
How does that work?
So the hormone that is supposed to be released and then give the signals to your brain to pump the blood into your penis. Some have deficiencies in that. Some have a low count in those hormones. Yeah. So basically they do the hormone therapy so that it gets the numbers up in their system so that that process can take an effect.
Okay.
That's mostly the testosterone.
Yeah.
Also, there are some devices that will help you to sustain. Yeah, we have the pumps.
Oh, okay.
You've seen some before.
Yeah.
Yeah. So that's basically how it works. So it pumps blood from into the penis to help it to sustain an erection. And also that one thing that we are forgetting is the psychotherapy. Yes, because we mentioned we mentioned that ED is also caused from psychogenic effects. Yes, so you need to speak to your therapist. Yeah, so a psychosexual therapist, he or she is gonna advise you, talk to you, and probably give you some therapy that would help you to improve upon ED.
Yeah. So
and also the surgery that we mentioned earlier with the implants.
Yes. Yes. Okay. Yes. I think that's quite extensive. There's so many options.
Oh yeah, there are so many options.
So what is a man to do? For example, if I realize that I have ED and I go to the doctor, or yes, I'm to start with my doctor, right? Ideally. Yes, I go to my doctor, and then what else? What happens from there?
So when you go to the doctor, of course you go to the facility, or even if you speak to him, the range of questions that he's going to ask you, if you have an erection, if how long it takes, under which circumstances do you realize that, or what's the circumstance that made you question that you have ED? Because you can't diagnose it yourself that, hey, I have ED, just because you've had sex with someone or you are not able to maintain. It can be any cause, as we said, the stress and all that. So the range of questions that she's going to ask you. And then if it's a checklist actually. So if there are some that you tick for, and then the other investigations, a lab test to check the count, and then other, if you can, is going to start you on medications to see if there's going to be a difference from what you're experiencing now to when you start taking the medication.
Yes, and also, we also mentioned that ED is caused by other underlying causes.
Yeah.
So we also want to find if you have underlying causes that is causing the ED. Yes. So
necessary.
probably yes, exactly. So hypertension, diabetes, any heart disease, any previous stroke. We have to rule all that out to ensure that there's no underlying condition that's causing your ED. Then we take it from there. After that, we mostly prescribe the sildenafil or the Viagra, 5 milligrams. You take it daily. Yes, and it works. It's actually a game changer in this sexual reproductive health. Yeah, because people who suffer from ED actually they respond to Viagra.
They really do.
They
do.
Okay.
Because if you don't have erectile dysfunction, don't go and be taking Viagra. I beg.
Just because you want to get a point or something.
Get a point. 1 hour now.
And now, my friend.
Okay, so now to the last part of this conversation. The women, how can we offer support? How can we help? Because, like I mentioned, sometimes we really feel like it's us, right? It gets so... It's sad.
It's
like, is it me? What did I do? Don't you like me?
Am I not attractive?
Yes, and then on the other side is he not a man? Does he have feelings?
So I think it's both sides too. Because sometimes too the male might feel embarrassed. Yes. In as much as you are also feeling like you're not doing much to arouse him. But he might also feel embarrassed actually. I'm here for action. Why am I not standing up? You see, yeah. But I think also you women have to help us but first of all we have to identify that problem ourselves and seek for help. Yes, then we communicate with our partner that this is what's going on. I mean, communication is key. That's basically it. If you communicate, you don't understand.
Yeah.
Yes, and from there you can take it.
Thank you, Dr. Noah. Dr. Isaac.
So he has basically said it all. Communication for the start of the said or whatever thing you are experiencing. Just have to communicate it. It's in some cases, it's not all the cases that communication is going to go on like that. Hey, you are ready for it, you've come now.
Yeah, you're
going like that. You're going to turn into a fight. It's how you're going to understand it. Both of you are going to understand it. Talk to him or talk to her about it of what you're experiencing, and then you find the next step forward, and then of course you get progress.
All right. Yeah. Okay. Thank you.
Thank
you once again, Dr. Isaac and Dr. Noel. This has been a very, very, very interesting conversation. If you at home and you are experiencing any symptoms or you feel like you have ED, don't hesitate to reach out to us on 1221 and we'll link you to either Dr. Isaac or Dr. Noel. It will be very confidential. Don't worry, I won't hear about it. Once again, I have been your host, Ivy, and this has been 1221 Live. Goodbye.
Room 1221. Room 1221.